Maybe you've never been concerned about your blood sugar levels, but you should be. When these levels are high, it means the body is having problems with insulin, which is needed to use sugar in the body. In the long run, these elevated blood glucose levels can lead to complications in the heart, arteries, eyes, kidneys, and nerves. Many people with type 2 diabetes are often unaware of their illness until abnormal sugar levels are detected in a blood test or until they experience serious complications as the disease progresses. Most of the time, diabetes is silent and insidious, and people do not exhibit symptoms in the early stages. However, in some cases, there are subtle signs. Some of the early symptoms of diabetes are well known, such as constant thirst, excessive urination, or sudden weight gain or loss, for example. Others, as we'll show you in this video, are more easily forgotten, both by doctors and patients. The first and last symptom we'll address next are the most ignored, and this mistake can cost you your health. Here are 5 early symptoms of diabetes that you should pay attention to. Inflamed or infected gums. Gum disease, also called periodontitis, may be an early indication of type 2 diabetes, according to recent research in the journal BMJ Open Diabetes Research and Care. The study reveals that individuals suffering from gum diseases, particularly those with severe conditions, have a significantly greater likelihood of having diabetes, both diagnosed and undiagnosed, and prediabetes, compared to individuals without gum diseases. The link between gum disease and diabetes is well known, and having one condition increases the risk of getting the other. The inflammation caused by gum disease occurs under the same factors responsible for high blood sugar levels that cause diabetes. Dark patches. Long before you actually have diabetes, you may notice the emergence of dark patches on your neck. This is called acanthosis nigricans and is usually a sign of insulin resistance, a loss of sensitivity to the hormone the body uses to regulate glucose, which can lead to full-blown diabetes. In rare cases, acanthosis nigricans can also be caused by ovarian cysts, hormonal or thyroid disorders, or cancer. Certain medications and supplements, including birth control pills and corticosteroids, can also be responsible. Strange sensations in the feet. Around 10% to 20% of people diagnosed with diabetes already have some nerve damage related to the disease. In the early stages, this can be almost imperceptible. You might feel a strange electric tingling in your feet, or experience decreased sensitivity or balance. Of course, these strange sensations can be caused by something as simple as wearing high heels or standing in the same spot for too long, but they can also be caused by other serious conditions, such as multiple sclerosis, so it's important to mention them to your doctor. Hearing or vision loss. One of the most common symptoms of diabetes is blurry vision. Excess glucose in the blood causes swelling of the lens of the eye, changing its shape and flexibility, reducing its focusing ability, hence blurred vision. When diabetes is managed effectively, vision is restored to its normal state. Likewise, elevated blood sugar can also affect the nerve cells in the ear and impair hearing. According to experts, this is something few people talk about, but experienced audiologists know to look for the connection. Long naps. A scientific study presented at a diabetes conference found that people who took naps lasting more than an hour were 45% more likely to have type 2 diabetes than those who took shorter naps or did not nap at all. It's unlikely that napping during the day actually causes diabetes, say the authors of the study. However, they also mention that this could indicate an underlying issue like sleep deprivation, depression, or sleep apnea. These conditions are known to be linked to a higher risk of diabetes. If you experience more than one of these symptoms, it's important to seek professional medical help to diagnose the cause. In the case of diabetes, the sooner the condition is diagnosed, the better. If the disease progresses, it can cause irreversible damage. The most effective natural and homemade method to manage diabetes and control blood sugar levels is by losing weight. This helps reduce body fat, improving liver and pancreas function, and increasing insulin sensitivity, making it easier for insulin to do its job. To successfully lose weight, it's essential to maintain a balanced diet and engage in regular physical exercise. However, alongside weight loss, there are also some plants that can be used to enhance the effect of insulin and help control blood sugar levels, especially in people with prediabetes. If you are already taking diabetes medication, it is important to talk to your doctor before using any plants or herbal remedies. Some plants can affect how your medication works and might cause serious problems like low blood sugar. To learn more about the best teas for diabetics, click on the video that is appearing above.